Hi, my name is Ruben Gobisi, and I am the director of the Cleveland Shoulder Institute. I hope this video on reverse shoulder replacement recovery helps you in your recovery to understand what the goals are and how to achieve them. First off, you probably know from our discussion in the office that a reverse replacement is typically used for people who have two problems: arthritis and a very large rotator cuff tear. Now, to be honest with you, in my practice, I use reverse replacements for many different reasons, but that's the most common. Irregardless, whatever the reason you're having this procedure for, the rehab more or less is similar for everybody. I choose a relatively aggressive approach to rehab because I believe that most people do better if you move them early. However, I mean move them early, not overwork the shoulder. There are several issues that I wanted to talk to you about with regards to reverse replacement recovery that I think are important for you to understand. A, after a reverse replacement, I don't feel that people need to remain in a sling. You can take the sling off after surgery, unless I specifically tell you you can't, and there are some exceptions, but most people, you can take the sling off right after the surgery. You can use your arms for what we call activities of daily living: eating, drinking, showering, shaving, dressing, and of course undressing. So those are the type of activities you can do out of the gate in the first week after surgery. And in fact, the faster you achieve those activities, meaning the ability to do them, the better it is, I think, for your recovery. I do say that the next week, so a week after the surgery, you should start therapy. And you probably know this from your preoperative visit, but I really prefer my patients to arrange all of this therapy visits, post-op appointments, and so on ahead of time before the surgical date. Once the surgical date comes, I'd like you to have all this. You should know when you're seeing us after your surgery for your post-op visit, when you're starting physical therapy, and so on. So anyway, a week after the surgery, you start therapy. In the therapy, you're going to start with passive range of motion for a week. I like everybody to lie on their back, and I'll show you the exercises of how I want you to progress through that. The goal is that between weeks 3 and 6 after surgery, I want you to have relatively good motion. Don't get carried away if you're at 6 weeks and don't have high motion. Most of you will, but some of you won't. Remember that, or if you don't know, let me tell you that post-operative motion and the progression towards good motion has a lot to do with the condition of the soft tissues in the shoulder. Another way for me to say how stiff you are prior to the surgery. If you're very stiff, it may take you a while. Most people are moderately stiff and they can progress quite quickly. In any case, most people between 3 and 6 weeks have pretty good motion, and of course, they have substantial pain relief compared to preoperatively. That's most people. Exceptions to this rule, and the most common really exception I can think of, is people who come in on preoperative narcotics. Now, if you've had preoperative narcotics, typically the most common group would be, for example, people with chronic back pain. You may find that your pain is much higher than what I'm describing for 2 to 3 or 4 weeks. And that's because of the body's response to seeing, quote unquote, seeing narcotics. It does not matter if you quit 2 weeks or 3 weeks before surgery or even 2 or 3 months. It seems to, in my experience, uh, impact the pain response after surgery. But for those, most of my patients are not on preoperative narcotics, so most people are off of narcotics within 7 days, 10 days at the most, and may use it for a couple of weeks only for sleep. That's the typical post-op course. It's not excruciating typically for most people. Otherwise, the key part of this is within the first 3 to 6 weeks, I expect to have pretty decent motion. And then after that, I pretty much stop therapy for most people. A lot of people say, well, I want to get stronger. Don't worry. You'll get stronger in a replacement over the course of a year. But you can use your arm, and as you use it, you'll get stronger. I do not like bands ever. Like at the therapy, these bands, nope. I don't like weights. And the reason I don't like it isn't because I have some strange uh, prejudice against weights and bands. It's because the risk is that most of the people I do these on are elderly females, and what I mean by that is people over 70, and most of them have some level of osteoporosis. And if that's the case, which it often is, one of the things that can happen 2 to 6 months after surgery are what's called stress fractures. And I'm sure you've heard of one version of stress fractures, such as shin splints that runners get. It's exactly the same phenomenon in the shoulder, where you get on the back of the shoulder a micro crack of the bone, a micro fracture of the bone. So you can't see it most of the time on x-ray, but it's very painful, and it never really happens right after surgery. It happens somewhere between 2 to 4 months, typically on somebody who went from very little motion and went haywire and went and did all sorts of stuff at home, and 2 to 4 months later comes in and says, oh, my shoulder's killing me, I can't move it. How were you moving it earlier? It was fabulous. Okay, those are the people who I worry about. Most of those get better, but it's a big damper on the whole experience, in my experience. So please, just stick with the protocol, be reasonable, and if you have any questions about exactly what you can and can't do, ask us. But we like you to be active and progressively active, so you give your body a chance to recover, because most of the people who have this go incredibly better range of motion, but because they haven't done it in a long time, their bone structure is a little weak, and it'll get stronger with time, but you have to give it the time. Other than that, I think most of my patients are very happy they did this operation. They're very happy because it's really restored functionality that they've lost, and also relieved a good deal of pain. Hope to see you soon. You have to do these exercises every day at home, okay? Remember, you want to put about an hour in every day. And how the key thing, and pretty much the only thing I care about in the first 6 weeks, and I mean that. I mean, I don't care about any other exercises. This is what I care about, okay? And I hope you understand that I care about it because it matters to you. You're going to start all your exercises in the lying position, okay? Whether it's on your bed, couch, sofa, whatever. And what you're going to have somebody do is, and you're going to need somebody to help you, is to support the back of the elbow here like this, and the hand as you see me here. And to keep everything in plane, meaning not out to the side, but in plane, comfortably at the side, just like you would do normally, comfortably at the side, right, and go straight up like that. So our elbow, the hand is behind the elbow here, and a rocking motion, just to loosen. Remember what we talked about in terms of getting the tendon to be less stiff, just to loosen, and eventually get that arm where it's not hard to do all the way up. Some of you will be really quick with this, and some of you will be, it'll seem painfully slow and tight. Either way, you keep working on it, because what you're trying to do is get to about 140 degrees of motion. Some of you can get to further, but most of you can't. They'll get to about that. That will be excellent, okay? You want to get there by really 3 weeks, sometimes up to 6 weeks, but you want to get there certainly by 6 weeks, because that's how I'll evaluate how you're doing. If I can walk in and raise your arm up like this, which is exactly what I do, at 6 weeks, A+, you can get rid of the sling that you've been in when you're not doing this exercise. You're in the sling, or you're not doing changing your clothes or taking a shower or something like that. You're in a sling. 6 weeks, if you can do that, you're out of the sling. Your second 6 weeks starts very similarly. You're going to be lying down just like this, okay? And your next goal then is to raise it yourself. Oftentimes I'll have you put a pillow here to start it from this position rather than totally at your side. Start from this position, and then try to raise it by yourself, lying down like this, okay? If you need somebody to help you initially, have your friend or husband or son or kid, whoever, help you do that, and just have an arm until you can do it there, and then really try to hold it down yourself. In other words, don't have them do the same thing you did the first 6 weeks. Have them help you only as much as you need it. So once you get it to there, make them bring you down like this, and then if you need help at that point, they can help you, and then once again up, and then let go if the person can do it, and then be ready to help as a back down. I don't want you to go out to the side. Not important at this point. The second 6 weeks, all I really want, the second 6 weeks, is rather than me lift it up, I'm going to have you sit up. So you do this for about a week or two until you can get your arm up. Then you're going to sit up, okay? And Janice will show you. You're going to sit up, and you're going to take your hand on the wall and slide it up the wall. You're going to face the wall now. You're not going to go out to the side. You're going to face the wall and slide it up the wall. The best way to do that is take a dry hand towel, okay, and put the hand on, not to walk it. I don't think that's very helpful. Rather, a dry hand towel, and you slide it up the wall. You push it up the wall. It'll easily slide with a hand towel. Once you can do that relatively easily, maybe 3 sets of 10, and don't get too caught up on how many times, just if you can do it until it feels comfortable, okay? And then get rid of it and try to do it in the mirror by yourself, you know. By the second 6 weeks, which is obviously 3 months, when you come in to see me, so I see you right after surgery, within 2 or 3 days you'll see me or one of my PAs. At 6 weeks I'll see you. At 3 months I'll see you. At 3 months what I'm looking for is for you to raise your arm. If you can raise your arm at 3 months, you're doing excellent work. And at that point you can stop therapy. Most of you can stop therapy and start to use your arm for activities as I described earlier in the video, whether it's golf and so on, swimming, you know, cycling, that kind of thing. You can use your arms. But we'll talk about specifics for your case when you come in the office, okay? But that's how it works. Thanks.